Hello everyone, I'm KRITHIKAA MUTHUKKUMAAR, first year medical student at University Malaysia Sabah. Today I would like to present on the heart for my special self-study module MM10208. So today we will be looking at the anatomy of heart, physiology of heart, disease and treatment, and world-known cardiologists. So a cardiologist is a physician that specializes in treating disease related to cardiovascular system. So let us look at the anatomy of heart. So this is how a heart looks like, and it has been labeled here. So heart is a muscular organ located in middle mediastinum. The main function of heart is to pump blood throughout the body. Mediastinum is a space between two lungs, and it is covered by a fibrous layer called pericardium. So now let us look at the orientation of heart. We can imagine a pyramid that has fallen down and the inferior part faces the bottom. The base of the pyramid is the posterior surface of the heart, and the inferior part of the pyramid is the diaphragmatic part of the heart, and the anterior surface of the pyramid is the sternocostal part of the heart, and both left and the right side of the pyramid faces the right lungs and the left lungs. And we can see that the base of the pyramid, where we tell the posterior part of the heart, consists of two atriums, and the apex of the pyramid consists of two ventricles. Now let us look at the margins of heart. We have four margins: right margin, left margin, inferior margin, and obtuse margin. So when we talk about right margin, it consists of right atrium and it faces the right lungs. And when we talk about the left margin, it consists of most of the left ventricle and a bit of left atrium, and it faces the left lung. When we tell about inferior margin, it mostly consists of right ventricle and a bit of left ventricle near the apex. And obtuse margin is a margin that divides the anterior and the pulmonary surface of heart. It is round shaped from the left auricle towards the apex of the heart, as we can see here. Then now let us look at the four chambers of heart. We have right atrium, right ventricle, left atrium, left ventricle. Right atrium and right ventricle pumps deoxygenated blood towards the lung, and left atrium and left ventricle pumps oxygenated blood towards the cell body. And this four chambers is separated by three septums, which is intra-atrial septum, intraventricular septum, and atrioventricular septum. This is to make sure that oxygenated and deoxygenated blood doesn't mix. So now let us look at the physiology of a heart. So I will be talking on cardiac conduction system. So first, heart is made of cardiac muscle, and it have some properties such as rhythmatic, refractoriness, distensibility, automaticity, excitability, and conductivity. So now the components of conduction systems are sinoatrial node, or known as SA node, atrioventricular node, known as AV node, atrioventricular bundle, subbundal cordial plexus, or known as Purkinje fibers. So I will explain more on this four components while I talk about the pathway of conduction system. So we can see that it starts from the sinoatrial node. Sinoatrial node, known as the natural pacemaker, will generate impulse, and it will be sent to the atrioventricular node. Atrioventricular node located in between of right atrium and the right ventricle, as we can see in this picture over here. And this atrioventricular node, or more known as AV node, will delay the impulse to make sure atrium contracts the blood, right atrium contracts the blood. Then it will send impulse to the atrioventricular bundle. Atrioventricular bundle, as we can see here, it is located in the intraventricular septum, and it will conduct the impulse from the AV node to the right and left bundle branch, where we can see it will separate to right bundle branch and the left bundle branch. Then it will, as we can see here, then the subendocardial plexus, or known as Purkinje fibers, which is located in the wall of ventricles, will spread impulse throughout the ventricles over here to make sure both ventricles contract and blood can be supplied to lungs and the body cells. Now let us look at disease and treatment. So I'm going to talk about atrial septal defect. Atrial septal defect means, as we can see here, there is a hole where between right atrium and left atrium. This makes oxygenated and deoxygenated blood to mix. This usually occurs in infants that has been given birth or in toddlers. So the common causes of atrial septal defect is congenital heart defects, genetic factors, and environmental factors during pregnancy. There are some symptoms of ASD such as shortness of breath, fatigue or feeling easily tired, swelling of leg, feet or abdomen, heart palpitation, frequent lung infection, stroke, and heart murmur. So if we never treat this, what it can cause? So it can cause when there is a hole between right atrium and left atrium, more blood will be sent to the lungs. So the right side of the heart have to work hard. So over time, the right side of the heart will grow larger and will be weakened. At the same time, when we supply more blood to the lungs, the blood vessels of the lungs have to overcome the pressure, which can cause hypertensive pulmonary. So there are few treatments that can be done to overcome ASD, such as medication, or when the opening is small, we can just go through further follow-ups where it will be closed as its own. Then we can do catheter-based closure, where you can see from the picture, a small tube or catheter will be inserted through the blood vessel to close the opening between the right atrium and the left atrium. When the opening is big or large and it can cause severe effect to the patient, we have to do open heart surgery to overcome this. So now I will talk about the well-known cardiologists. So the first one is Tan Sri Dr. Yahya Awang. He is known in cardiothoracic surgeon. He is known for open heart surgery in Malaysia. He is also the founder of IGN. He also has led the team that performed heart bypass surgery for our former Malaysian Prime Minister Tun Dr. Mahathir. He had won many awards such as Tan Sri title and many awards for the contribution in medical fields. And another specialist is Dr. Chowsky from India. He is an expert in treating complex heart condition with emphasis on non-invasive cardiology. He is known for treating high-profile patients in India and renowned for the diagnosis of cardiologists and preventive care. He has experience in extensive care with significant contribution to cardiovascular disease management and treatment. What I admire about him most is where he does not only treat patients, at the same time, he creates awareness in his social media about cardiovascular diseases or how a person can conduct a healthy lifestyle. So these are the reference I used for my presentation. So that's all from me. Thank you very much for listening.